here today at Progressive Fitness CrossFit. This is Rachel, and we're going over a distraction in the hip. This is for someone who I believe has lumbopelvic hip complex dysfunction or lower leg dysfunction. So you're going to start with the band as high as you can up in the hip area, and you're simply going to get in your quadruped position so your shoulders are in line with your elbows, in line with your wrists, and you should be far out enough that you feel a pull, but not far enough that you feel the opposite leg working. You especially do not want to activate those inner thigh muscles of the leg that does not have the band on. From there, you're just going to shift forward and backwards, away from the band and towards the band. You're going to do about 15 to 20 reps of these. Now that's your first progression, and you may just want to stay there. If you're feeling pretty safe and you have zero pain during this, you'll move to the next progression. And that's going to be moving backwards and then back to neutral. Now, if you do find a pain arc, go as far as you feel the pain, stop right before the pain, and you're going to do short oscillations. So you're going to bounce back and forth about twice per second. So a little bit faster. Good. Now, if you feel good during this motion, you're going to go all the way back, pull your bum towards your heels, and you really want to keep active. You don't want to shift during this movement. You can come back up. Another helpful tip here is looking between your legs and just watching go back, making sure that you're not shifting out towards the side. So you'll go back and forth for that 15 to 20 reps in that. Now, if you want to progress to the next progression, then you're going to now go back all the way to the knees and all the way forward into extension. You can come back up and push forward all the way. Keep a nice strong back. Think about your plank positions and go back towards your bum. And you can do those 15 to 20 reps, making sure again that the opposite leg isn't activating. You don't want to activate that. You might feel a little bit in the glute here, but other than that, you will not feel much. It's just a distraction. It's not meant to be aggressive.